A benign prostate enlargement can force a man to wake up 2, 3, maybe even 4 times a night to go to the bathroom. Dr. Seth Hollenbach, a urologist with CHI St. Vincent in Hot Springs, is here to share details on an easy fix for this problem, which, Seth, affects so many people out there. I didn't realize. How many does it exactly affect? A rough estimate, at least?
Yeah, I see guys every day in clinic. About 38 million guys in the United States every single year are diagnosed with this.
Every year?
Every year.
Unbelievable. That's way more than maybe you typically think about. It affects a lot of people, and affects families at the same time.
You bet. It affects the guy, it affects his wife,
Yeah.
It affects the kids when he's waking up all night long, it affects everybody in the house.
All right, let's talk about some of the symptoms. We mentioned getting up and going to the bathroom. Anything else to keep in mind?
Mainly the waking up at nighttime, I got to go all the time, I can't make it, not emptying your bladder all the way. Many things will start to irritate a guy that they'll come in the clinic for.
And how severe of a problem can this be for some guys out there?
It can be bad problems, especially when you consider waking up at nighttime and not getting enough rest. Because then the next day you're affected, you're still tired, and it's just like a self-fulfilling prophecy. Every single night you go to bed, you don't get enough sleep, then you're more tired,
Domino effect.
Yeah.
Even though it might be a problem down in your prostate, it can affect your sleep patterns, your brain function, and really hurt
everything else. That's right.
Reduced quality of life, I know, is something that you talk about. It really does. It limits things that we consider everyday chores, duties, options, and it really can limit some things.
Oh, absolutely. Our entire generation is about quality of life, and it really does. When you don't sleep, you can't empty your bladder, and then it affects your lifestyle, it affects your wife and your kids and everything else.
Traveling.
Every time you go somewhere, you think about where's the bathroom. It really affects your life.
And focus can turn to that instead of maybe what you should be focusing on, like an event, an outdoors, a vacation, especially, and that'll definitely affect the family. All right, let's talk about treatment options.
Okay. Traditionally, the treatment options were always medication first, and then some people nowadays have even turned to the herbal therapies, even though they're not necessarily clinically efficacious. But the medications, sometimes they don't work enough. There's side effects like erectile dysfunction and nausea and dizziness and things that people will even stop those medicines for. Surgery is then the next option, and traditionally we've had more invasive therapies that require hospital stay, bleeding, erection problems, and guys, they're just not willing to deal with that stuff. Nowadays, we've got a brand new thing that's come out at the first of the year that's made it available to most urologists nowadays, and we've done several of them. It's minimally invasive. The side effects are almost gone, and the guys are really seeing great improvement from it.
Wow, that's impressive. Because obviously you don't want to resort to surgery, but if it's like that, if it's obviously evolutionized now to the point where it's minimally invasive, that might entice more men to go. Because let's face it, guys, we don't even like to go to the doctor.
No, we don't like
for a
to
checkup.
go. That's right. We don't like to go. We certainly don't like to stay in the hospital. We don't like talking about it. And the quicker you can get in and out and be back to your normal activities, the better.
How about the results after something like this, the newer form of
we've done several of these now. We've really seen good improvement from these guys, and the best thing that they like about it is minimal side effects, no hospital catheter stay, and their symptoms are greatly improved. They're really happy with it.
Of course, we talk about benign prostate enlargement, but a lot of guys get scared when they hear the words prostate cancer.
That's right. Well, you hear the C word. Nobody wants to hear that. This is more for the non-cancerous side of things, so it's really more for symptom control. The cancer thing would take you down an entire different pathway.
That's a whole other topic, right?
That's a whole other topic. We can do that again.
Now let's talk about real quick. Tell me about the age for something like this. When do you typically see an enlarged prostate? What age should a guy maybe start to consider? Maybe I have that.
Right. So the earliest I'll ever see is late 30s, early 40s. But most of the time we tell guys, hey, look, when you're over 50, you probably need to start thinking about things like that, especially the symptom control, and it's like you said, the C word, the cancer. That's when you really start the screening process.
What about prostate exams, just to get a checkup? Maybe what's the right age, or the first time maybe a guy should consider going to getting one? So
in general, 50 years old, people will come in the clinic and they're going to get, number one, a PSA check with a blood test, and then an exam, a prostate exam, and ordinarily that's 50. Now, if you've had anybody in your family that's had prostate cancer, you're going to back that up 10 years. So
10 years.
If your dad was 55, you're going to start at 45.
Okay, some good things to remember today, and hopefully if you have any of these issues like so many men do and get diagnosed every year, wives, if you're watching right now, encourage your husbands to go to CHI St. Vincent in the Hot Springs Urology Clinic there, chistvincent.com for more information, but there's the address on your screen and the number to call if you want to call ahead and make an appointment for them. You could of course do so, get them to see the great folks over there, get it taken care of, and hopefully knock it out. Thank you so much for coming in today, Seth. Really appreciate you stopping by, man. All right, coming up next, we are going to learn more about remodeling your bathroom. We talk about